Does American society simply not care about old people? That's the argument put forth by elder advocates who cite indifference toward COVID-19 deaths and poor nursing home care to make their point. But if we take a step back, maybe it's actually children who are getting short shrift. So, are baby boomers starting to sow what they reaped with their glorification of youth culture? Or is society really not to blame after all? Welcome to CareTalk, America's home for incisive debate about healthcare, business, and policy. I'm David Williams from Health Business Group.
And I'm John Driscoll, the president of Walgreens Health. David, why are you attacking? You seem to be attacking the boomers here. They're the ones who suffered. I mean, where were you coming? How do you come at that?
Boom, boom, John. I mean, not all the seniors are old. Not all the boomers are old yet, but they're getting there. I mean, here's the argument. So if you look at what COVID did, it took a gigantic toll on seniors. About 3/4 of about 900,000 people who died in the U.S. were seniors. And what's happened now is that, okay, COVID's sort of over and people are just accepting it as a part of life. And so, people aren't masking. So that's maybe hurting seniors, even though they're still dying from COVID. Seniors aren't getting antiviral therapy. They haven't necessarily got the latest COVID shots, and there's little progress on care quality in nursing homes. So people are saying, hey, we don't care about seniors.
Well, I mean, to be fair, it took some time for us to actually understand that 3/4 of the deaths from COVID that we were all scared of were hitting seniors, that it was disproportionately dangerous for an elderly demographic. When we first got into COVID, there was a fear that this could be like the 1918 flu, where it was disproportionately took the lives of 20 and 30-year-olds. And so I think we were very slow to actually look at the true trends in the data. And to some degree, I don't think we've done a very good job of figuring out, well, why did that happen? That we've got weaknesses in our nursing home infrastructure, that we probably don't protect patients as well on intake. I mean, you visit any ER in a busy hospital system in America that's running at 100% of census, which is a lot, where their beds aren't available. You're literally keeping people in hallways, and even in places like the Brigham, David, where you are, which is the vaunted Harvard system, they get overwhelmed, and we've lost the discipline of masking. We came late to it, and then I think have dropped it. We don't necessarily have a healthcare system that protects our most vulnerable, and when it was stressed, it clearly failed. But I think to be fair, we were late to figure that out, and I don't think we've actually instituted many changes to improve the safety and secure our actual healthcare system from doing more damage than good for medically vulnerable seniors.
Yeah, I mean, I remember at the beginning of the pandemic, people were thinking, well, if people have been around a long time and maybe they had the flu or something else, maybe they have some immunity, whereas younger people don't. So there was sort of a thought of, okay, well, maybe the seniors would be safer. Now, I think it's a bit much for people to, all know the statistics about how much it affected the elderly. And then also, while masking is definitely helpful, it's a little bit indirect to say, me wearing a mask is going to have an impact on older people, even if I'm not around them that much. And I think most people can't be expected to understand what's going on with nursing homes. And the nursing homes are just trying to get, staff to come in. So.
So you've got excuses for everything today.
Yeah.
I mean, nursing homes, we know that nursing home staffing ratios are thin. We know that the money that has been invested in nursing homes is much more about the real estate than the healthcare. And that, the president has had a really hard time, and the healthcare system has had a really hard time enforcing higher standards for, housing and caring for our most vulnerable elderly folks. And we've lost, a generation of elderly folks. One of the reasons why I believe life expectancy is flattening is, one is obviously deaths of despair, but the other is deaths that sort of are due to our failure to repair the system where we know it's broken, where medically vulnerable seniors, folks over the age of 75, are particularly vulnerable.
So we should repair the despair and I'll grow back my hair? John, there are some reasons to think about why. Okay, let me go back on the other side of the argument, and I'll stop with the excuses and say, why does this appear to be happening in terms of maybe older people being looked down upon? Well, I think there is an argument that the pandemic maybe made prejudice against older adults worse. There's some evidence of that. There's a lot of ageism in the society. And also older people tend to be segregated from the population. Those people are, when you talk about nursing homes, that's by definition, home away from where the family home is. And so there are certain factors that, that do lead maybe to the elderly being marginalized.
I mean, the way I think the right way to think about it, David, is that American society has always celebrated youth, and even your long-term care commercials show elderly folks, hopping on at least on the way out, hopping on a surfboard to hit that next wave. Not necessarily being clear what happens after and when they return, but there's a you make a really interesting point that in a lot of more traditional societies that are typically the blue zones that Dan Buettner talks about, families and age together in the same community, and people stay together, whether it's in the Asian communities he's looked at, the Italian communities he's looked at. I know it's true in terms of Irish villages that are populous, where folks tend to age in place and with communities, and people take care of each other, and you see your elderly relatives. Whereas in the United States, I think part of it's due to just the demographics of a growing society, and where people are, don't necessarily work where their families are, or end up living where they grew up. And I think all of that plays into an isolation. But what's ironic is we actually, as you know, disproportionately spend a lot more money from a healthcare perspective on the elderly as opposed to youth, where frankly the dollars would go a long way, whether you're talking about vaccinations or pediatric care or prenatal care. And so we're spending money, but not necessarily getting the results we should, which would be a better lifespan as well as health span, more better life as well as a longer life.
One of the reasons that this article and this argument rubbed me the wrong way was that I think, are you kidding me? Like the older people are very well represented in this country. So there's the spending side. So on healthcare, as you say,
they're probably the only people represented in leadership.
Yeah, well, exactly. So we have, on the healthcare side, Medicare, which is heavily, the spending is for almost all for people that are over 65. And although it's funded partly by payroll deductions, much of Medicare spending comes out of the general budget. There's also Social Security. And then even within Medicaid, which you think about is the program for the lower income, much of the spending there goes to nursing homes. And that's where nursing home support is. And that's for older people. Now, as you say, in terms of leadership, our current and prospective leaders are all up in this age category as well. They may be surfing not into the sunset. I mean, this is what we're dealing with. So it could be a youth culture, but we've got older people running the place. You could make the argument, John, and I would go ahead, I dare say that you could say, instead of saying that society doesn't care about old people, you could say society doesn't care about young people. It's only about 10% of federal spending is actually on children, just as an example.
Well, no, and 50% of all births in the United States are on Medicaid. And that would indicate that we're not doing a great job at taking care of the next generation or generations that hopefully will take care of you, David. I mean, it's crazy that 50% of all births are on people who can't afford health insurance and are therefore having to rely on, the Medicaid system. I think that all of this points to a broader problem, which is that we don't kind of look at our healthcare spendings in the way we would look at it from a business perspective. What's the return we're getting on those investments? There's definitely some probably mismatch or a lack of goal setting around, like, what's our goal in Medicare? It should be, I think, to improve quality of life and lifespan. For sure, but also health span, the quality of life. And I don't think that that's really, that's not a metric we've used. And I think the same thing should be true for healthcare spending on youth, that there are, where are we going to get the broadest and biggest return on those healthcare dollars. And then you look at those against one another and realize that if we don't take care of the young generation, the old generation is going to suffer because we aren't going to have caregivers. We aren't going to have people having enough babies. We aren't going to have healthy enough people to actually provide the care that our society's going to need. But I think it starts from kind of taking an ROI perspective on it. I mean, would you think that would work and that would help?
Yeah, and John, I like your argument about health span and lifespan. Let's look at that at the two ends of the spectrum. So for older people, we do have, Medicare, hospital care, and although the lifespan isn't as long and the health span isn't as long as in some of the other industrial countries, on the other end of the spectrum, the comparisons are much worse. So if we're, a few years behind Japan and Northern Europe on lifespan and health span, look at the front end of it and see infant mortality and maternal mortality. It's much closer to, an undeveloped country, a low-income country, than it is to the peers. They're not even close. So that says something about, your argument right there, even if we don't get into the finer points of return on investment. And if you just look at the poverty rate, the poverty rate for seniors in 2022 is about 10%, 10.9% versus 16.3% for kids. Interestingly,
Crazy.
During COVID, John, we actually did see a big difference here, and kids were actually taken care of, and we could actually do something about child poverty in the near term even.
Well, it's a great example, David, because during COVID, due to basically three reasons: an expansion of the earned income tax credit, which puts money into or allows poor working families to keep more of what they earn, a relaxation of standards for Medicaid, that's the coverage for the poor that pays for healthcare insurance, and a relaxation of standards for food stamps. I mean, child poverty dropped dramatically. It was 12.5% in 2019. And it's kind of offensive to think that nearly 13% of our kids, couldn't afford to get, 3 square meals. And in 2021, it was, I think it was down to 5%. I mean, that's a dramatic reduction, but it shows you the power of federal and state programs to dramatically change the quality of life for the people that government serves. And what that means is when you go from 12.5% to roughly 5%, is those kids who are no longer in poverty, they're going to have higher IQ scores. They're going to be more likely to go to school. There are long-term healthcare costs, not just their costs of care when they're young, but their long-term lifetime costs will actually drop. It is a very high return investment to lift kids out of poverty. It produces more working adults and healthier adults to kind of fuel the economic and social engine of the United States. But it's a great example that in a very short period of time, by investing and relaxing standards, including more people in poor communities, that we will, I think, dramatically change those kids' life outcomes for the rest of their lives.
John, you started off the show by asking about baby boomers and whether they should be blamed. And I'm going to go ahead and close up by actually blaming them and laying the blame on them. Here's why, John. So I think the baby boomers are the ones who really invented the youth culture and idolization of youth. So in some ways, it's just like, hey, what goes around comes around. And then you could actually understand the resentment by younger folks about what the baby boomers have or haven't done on the environment, climate change, the political system, the national debt. And, so maybe it's fair to, to pin it on the boomers.
Well, I don't think you're wrong, David. The boomer generation is responsible for generating a lot of debt, the federal government borrowing a ton of money to pay for a lot of programs that may or may not work, and not even pay attention to the long-term costs of that compounding debt on the next few generations. But based on how they're doing in the Medicare program, they're going to have to pay a lot more attention to the younger generation to fix the flawed system that they built.
Well, on that note, John, I'll say that's it for yet another episode of CareTalk. We've been talking about the old, the young, and what can be done. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the president of Walgreens Health. If you liked what you heard or you didn't, we'd love you to subscribe on your favorite service.